Have you ever wondered why your period is so heavy? Do you find yourself changing pads and tampons every 1 to 2 hours? If this sounds familiar, then this video is for you. In today's video, we're talking about heavy menstrual bleeding, what is medically known as menorrhagia. Let's get started. Menorrhagia is a condition that causes excessive menstrual bleeding. A normal period usually lasts 3 to 7 days with moderate bleeding, but with menorrhagia, the period lasts longer than 7 days, and you might as well soak through your pads and tampons very quickly. Heavy menstrual bleeding is common, affecting about 27 to 54% of women who menstruate. Menorrhagia can have different causes, ranging from hormone-related to certain medications and sometimes some medical conditions. The first we'll be talking about is hormonal imbalance. Now, some of the hormones that our body produces as female, such as estrogen and progesterone, they play a role in regulating our menstrual cycle as well as how heavy the period flow can be. Now, if you have any condition that will cause an imbalance in these hormones, then this could result to heavy menstrual bleeding. Some causes of hormonal imbalance that could result in heavy menstrual bleeding include anovulation, polycystic ovarian syndrome, and a thyroid disorder. The number 2 cause of heavy menstrual bleeding is your weight. If you weigh more than your ideal body weight, then this can interfere with your body's hormone production, resulting in heavy menstrual bleeding. If you're dealing with overweight, please talk to your doctor on how to go about weight management. The next is non-cancerous growth in the uterus. Benign growth in the uterus or presence of any condition that causes cells of the uterus to grow inappropriately can result in heavy menstrual bleeding. Some of these conditions include a polyp, a fibroid, and adenomyosis. The next is infection. Infections including sexually transmitted infections such as chlamydia, gonorrhea, trichomoniasis, and a chronic endometritis can result in heavy menstrual bleeding. The next is a bleeding disorder. Some women have conditions that prevent their blood from clotting properly, leading to heavy menstrual bleeding. Some of these conditions include a platelet disorder and von Willebrand disease. The next is certain medication. Some of the medications that can result in heavy menstrual bleeding include blood thinners. Example of blood thinners is aspirin or warfarin. Number 2, chemotherapeutic drug. An example is tamoxifen, which is used for breast cancer treatment. Hormonal replacement therapy can also result in heavy menstrual bleeding. And then some birth control pills can result in heavy menstrual bleeding, and that is why it is important that if you are on any contraceptive and it is time for you to remove them, such as IUDs, it is important for you to notify your consultant so that it doesn't result to an abnormal uterine bleeding. The next is cancerous growth in the uterus. Precancerous conditions such as endometrial hyperplasia, cervical cancer, or uterine cancer can result in heavy menstrual bleeding. Some of the symptoms of heavy menstrual bleeding include 1. Having to menstruate longer than 7 days. 2. If you have to change your pants or tampons every hour for several hours in a day. Number 3, if you have to wake up at night to change your pads. Number 4, if you have to use more than one pad at a single time to prevent leaking. Passage of large size of blood clot. Feeling dizzy and tired could also be a pointer that you're losing too much blood. If you experience severe lower abdominal pain that restricts your daily activities, All of these could be a sign of heavy menstrual bleeding. One of the common complications of menorrhagia is anemia. If you experience heavy menstrual bleeding, what it simply means is that you are losing a lot of blood, and this can result in anemia. If you experience this, you should take supplements and vitamins, and also ensure to eat well so that you don't suffer from anemia, because it can be life-threatening if not properly treated. A pelvic ultrasound scan is the commonest way to diagnose heavy menstrual bleeding. However, other tests can be done depending on your age and how severe your symptoms may be. The treatment options available for heavy menstrual bleeding depends on what is causing it, the severity, age, medical condition, as well as the overall health of the person experiencing it. In some cases, menorrhagia can get better without medical treatment, especially if it occurred as a result of a mild hormonal fluctuation. Some of the ways menorrhagia can be managed include lifestyle modification, that is eating healthy as well as exercising regularly. Number 2 is the use of drugs. The first group of drugs that can be used include NSAIDs, what is known as the non-steroidal anti-inflammatory group of drugs. An example is your ibuprofen. Number 2 drug is zinc supplement, and then lastly you can also use tranexamic acid, which is an antifibrinolytic. For severe cases, some medical procedures need to be done. An example is dilatation and curettage, and this involves removing excessive uterine lining. Also, endometrial ablation can also be done. Now, if the cause is a fibroid, myomectomy can be done. And then lastly, which is the last resort, is an hysterectomy, that is removal of the uterus. And that occurs if the menstrual bleeding becomes so severe, painful, and unbearable. In conclusion, menorrhagia is more than just heavy menstrual bleeding. It is a condition that affects the quality of life. But the good news is that it can be managed. If you find yourself struggling or dealing with heavy menstrual bleeding, you should see your doctor to get appropriate treatment. Thank you so much for watching today's video. I also believe that you have learned something new in this video. If you have, do not forget to give this video a thumbs up, comment, share, and if you have not subscribed to my YouTube channel, please subscribe to it. You're going to love it here. Thank you so much, and see you in my next video. Bye for now.